All right. Thanks so much for being on the Friends with Wheels podcast. If I could get a little bit about yourself and how you started, we can go right from there.
Sounds great. First off, thanks for having me. It's good to talk with you today. My name is Dr. Jennifer Stewart. I'm a licensed clinical psychologist based out of Washington State. I've been a clinical psychologist for about 5 years now, and got interested in it in undergraduate when I realized I don't know, how much I enjoyed getting to like hear people's stories and be alongside them for their healing journey. Kind of got really interested in that and went down the psychology route.
Mm-hmm. And what do you do like nowadays as a psychologist? What sorts of things do you focus on?
Yeah. So I worked in hospitals for a while, and as of last year, I'm now in private practice. I focus on trauma, both kind of chronic and episodic trauma, childhood trauma, and personality disorders. So borderline personality disorder, particularly. I do a lot of work with DBT, which is a very specific kind of therapy. And I work with people kind of in transitional periods, kind of trying to like in big kind of like periods of change.
Mm-hmm. Let's get, I know you mentioned earlier that you said you used to work in hospitals before you transitioned to private practice. What was that transition like?
Um, it was really interesting. I really have enjoyed working in hospitals. In the past, I was an inpatient like many years back, and then outpatient, just kind of in a hospital setting. It's been kind of a strange transition, not having colleagues anymore. I've been really trying to get to know the other folks in the area because it's odd to go from a whole team to just me and my cat, who's also on my team. He often makes guest appearances in my sessions. Um, it's been fun. It's been a fun new journey and adventure. It's one of the things I love a lot about psych is that there's never really a dull moment. Nothing ever really stays steady for very long. And that's been, I think, a really fun part of this field.
Mm-hmm. Since you work with folks with like border personality disorder, like I want to get a sense of like what goes on in the therapy room when you have a client who has those symptoms, has borderline personality disorder. What's sort of the first thing that you sort of notice when you meet with with clients who have those characteristics?
Yeah, a lot of clients come to me when they're struggling a lot with emotion regulation. So people who tend to kind of fall into having a lot of mood swings or really struggling to keep relationships that feel like healthy and fulfilling and often feel kind of like out of control of their own emotions and their own lives. And that's sort of how folks end up with me. It's, some of them have borderline personality disorder and some of them just kind of have that emotional piece. And we focus in DBT a lot on what's called building a life worth living. So kind of trying to figure out what would life look like if it was feeling really fulfilling to you, and then what skills and tools do you need to get there? What insight do you need? What kind of like stuff do you need to help you? So we do a lot of skills based work. We do a lot of just like insight, like what are you noticing? What's happening? How often are you having urges towards things? Can we change these behaviors um, into behaviors that are more effective for you, right? So something that instead of doing a coping method that's maybe not the most effective, trying something that will actually make things feel better, and kind of make your life a little bit better.
Mm-hmm. Because I was going to ask, what are some of the activities that you use to help folks with borderline personalities to sort of like figure out how to sort of keep their emotions in check?
Yeah. So we do a lot of work in DBT in group settings. And so I run a lot of skills-based groups where I teach people emotion regulation skills, distress tolerance skills, and then interpersonal effectiveness skills, as well as mindfulness. Mindfulness is a huge piece of DBT, like being able to be in the present moment and being aware. So we teach skills like, okay, how can you identify your emotions? What emotion are you feeling? What do you need right now to like, is this emotion going to be helpful to act on, right? Like sometimes when you're angry, it sounds like it would feel really good to like yell at somebody, right? And maybe yelling at your partner is going to make things a little bit harder or make your life a little bit more stressful and complicated after you're not angry anymore. And so it's a lot of like, okay, how can we get you back to this kind of more balanced part of your brain, which we call wise mind? How do you get to wise mind and then figure out what to do moving forward? help, we do skills that help people get out of, when people are in big emotional crises and they're really like feeling very overwhelmed, how to get people back to baseline. We do things like cold water stuff, some physical movement, some breathing. And then individually, I work more with kind of people who struggle with maybe some self-harm or suicidal kind of thoughts.
Mm-hmm. And I know that you said that that you use DBT as your main source, but do you use other ones as well?
I do. So I do DBT like really structured specifically. And then when I'm not doing that, my style tends to be kind of a mix of DBT, of like ACT, which is acceptance and commitment therapy, and then some relational psychodynamic therapy, which is more about how relationships and relational patterns shape our life and our mental health. I kind of do a combo when I'm not just doing DBT.
Mm-hmm. So, oh, so you're kind of like interchanging like between like modalities as not to like one specific.
Yeah. Yeah. So when I'm doing DBT, I'm like doing DB, that's my thing. When I'm not just doing that, I like to bring in a bunch of stuff, right? Because everyone is so different. Like
Right.
one thing is not gonna, sometimes you're like, oh yeah, we need to bring in some skills. Other times you're like, we need to dive back into these patterns, right? And so it's a little bit more free flowing. I try to like really pick what's going to be helpful for the person sitting in front of me, right? Because obviously every single person's different and every single person needs something different. Which is kind of the fun artsy side of doing therapy, kind of
Mm-hmm.
mixing it
My
together.
mm-hmm. My next question is what's been like your favorite part or like your most fun part about doing what you do? And like what's been the most challenging part? Let's go with the favorite and fun part first.
I think my favorite part is like the people I get to meet. It's funny. I think people sometimes think, oh, therapists only care about their patients because we like pay them to care. I actually really do care about the people I work with and really enjoy them and really enjoy getting to like know them. It feels like such a privilege to get to like be on this like healing journey with someone, like to be open and to be privy to all this like vulnerable kind of stuff with somebody. And so getting to do that, getting to know somebody has been great. And my patients like crack me up sometimes too, like it's just so fun to get that interpersonal thing. I think that's been my favorite part of this job so far.
And what has been your most challenging part in terms of like c being a psychologist? Because it comes being a psychologist comes with its own share of challenges. So if you could talk a little bit about that.
Totally. I would say there's two things that are really challenging. The first is just the paperwork. We have to keep medical records, and man, it's so frustrating to do. And then the other thing is just maintaining, we as psychologists have to do a lot of like self-care and self-reflection, right? Because we do take on a lot of emotional stuff. And so just I think I've gotten into a really good pattern with it, but just needing to be aware of like, oh, I'm feeling kind of off today, or I'm feeling kind of tired, or maybe I need to spend some time this weekend turning my phone off and just kind of spending time being in the moment. That I think is the hardest piece. It's different from other jobs in that like if we're not fully emotionally okay, it's hard to like show up. So that's been kind of tricky.
Yeah, it's the burnout that always gets people, right?
It's the burnout that get yeah. And it's just really about how to manage it. It gets easier the more you do it. And I talk with colleagues, 'cause all my colleagues are also trying to manage burnout and try to be really good about. I have a pretty good self-care routine and stuff that I'll do. So it's yeah, the burnout's real just for so many jobs, right? Burnout is such a big problem.
Yeah. Who has been like your mentor that sort of helped you guide to where you are today as a psychologist? Was there like a professor? Was there like someone that sort of said, "Hey, you should go for this"?
It's a great question. In undergraduate, I started as pre-med and I've always really loved sciences and realized I didn't really fully, I loved my psych class, but I didn't really fully love my hard science classes. And my like the head of psychology who I spoke to was like, why don't you be a psychologist? And I was like, oh, never thought about that. Like that's a great idea, right? And then after that, I've been incredibly lucky to have had so many really, really good mentors through the years. I think I've had various like clinical supervisors, professors, my research mentor in grad school, supervisors in my jobs, colleagues who I've met who have mentored me, right? I mean, we learn so much from each other. I've been really, really lucky to have had so many good ones. I think um, I don't know. I hope that I can kind of give back to the next generation of psychologists. I feel incredibly privileged to have gotten the support that I've gotten. Um, so that sounds like a cheesy answer. It's true. This is such a community-based job, I think, really to get to the end.
Hmm. And for those who want to do what you're doing, become a psychologist, what tips of advice would you give to them who want to become a psychologist just like you did?
Yeah. I would recommend talking to mentors, especially if you're an undergraduate thinking about becoming a psychologist, so that you can kind of line up the experiences that you might need to do to get into grad school. So if you're trying to get into a PhD program, you need to have had some research background, so getting involved in research labs. The other thing that I did that was actually recommended to me by a mentor in undergrad was I took a gap year between undergrad and graduate school and worked on a hotline. Like I worked on a sexual assault hotline actually. And it was a really nice way to like try out kind of doing therapy because there's really no way to like do therapy before you have a higher degree. And so you're kind of like entering blindly into like, I think I want to do this and like hope that I like it, right? And so working on the hotline was really helpful way of being like, oh, I actually really like getting to like do this style of work. And that ended up shaping, I did all my research in graduate school on sexual assault trauma. So ended up shaping a lot of my graduate experience. And I think that it was a really helpful thing to do. So I would recommend that just for trying it out as well.
Hmm. Does that hotline still exist?
It does. Yeah, I think so. Last I checked, it's the RAIN is the name, the Rape, Abuse, and Incest National Network. They have a online like chat hotline, which I think is lovely. Sometimes phone calls can be kind of intimidating for people, especially a phone call to talk about trauma, right? So I think the chat part is kind of nice. Last I checked, it still existed. I know there's been some funding issues with some hotlines in recent years.
Hmm. All right. Okay. Okie dokie.